Hello everybody, and thank you for joining today. My name is Cheryl Fatibene. I am the Chief Nurse Practitioner Officer at the NNCC, and on behalf of the National Nurse-Led Care Consortium and the AANP, I would like to welcome you to today's Lunch and Learn, Cultural and Linguistic Competence, Health Practitioner Assessment. Our presenter today is Suzanne Bronheim, Associate Professor of Pediatrics at Georgetown University. Today's webinar is being recorded and will be available in the upcoming week on our Nurse Practitioner Support and Alignment portal page, and a link to the recording will be sent to all registrants. All participants will be muted throughout the presentation. I encourage you to submit questions during the presentation. Please use the Questions tab on your GoToWebinar control panel as seen here to ask a question. It will be relayed to the presenter and answered at the end of the webinar. A survey will pop up at the end of the webinar and will be sent in an email later today. Please take a few minutes to complete the survey, evaluating this activity, as your feedback is critical to the ongoing development and presentation of our webinars. The slides for today's webinar are available as a handout, which you can access via the Handouts pane on the control panel shown in the picture. You can click the name of the handout and it will download via your default web browser. Let me take a moment to talk about the national investment taking place for quality improvement in the U.S. with the help of our federal government and the organizations who are presenting this content as part of Transforming Clinical Practice Initiative. This is that has sponsored today's presentation. The Transforming Clinical Practice Initiative, or TCPI, is CMS's largest ever investment in practice transformation, with an investment of over $700 million, over 4 years, and an enrollment of 150,000 providers across the country. The NNCC, or the National Nurse-Led Care Consortium, is a membership organization with over 250 nurse-led practices in our membership roster. Our mission is to advance nurse-led care through policy consultation and programs to reduce health disparities and meet people's primary care and wellness needs. Our partner in this initiative, the American Association of Nurse Practitioners, is the largest full-service national professional membership organization for nurse practitioners of all specialties. It is leading the way in advocacy, continuing education, and professional development for over 72,000 members. CMS funded the NNCC and the AANP to support enrollment of nurse practitioners into practice transformation networks, or PTNs, across the country, and to develop NP-specific educational material that facilitates practice transformation in advance of the upcoming payment reform and changes with CMS. The AANP and NNCC are the only nursing-focused grantee of this TCPI project. The NNCC and the AANP agree that this initiative is important to ensure NPs receive the support they need to remain competitive in the changing healthcare landscape. NPs are the future of primary care in the United States and already provide high quality and cost-effective care. This initiative is an opportunity for NPs to prove it by helping CMS and the broader healthcare community build the evidence based on practice transformation while preparing for value-based reimbursement. CMS is not providing this funding out of the goodness of their hearts. They want to use this program to prepare clinicians across the country for payment reform. In particular, payment reform under MACRA, the Medicaid Access and CHIP Reauthorization Act of 2015. Many of you have probably heard of MACRA. It's legislation that was passed to establish Medicare's Quality Payment Program. Under the Quality Payment Program, or QPP, there are two payment adjustment mechanisms to incentivize quality tied to Medicare Part B payments, MIPS, which has been getting more news and we've heard about lately, or merit-based incentive plans, and advanced APMs, or advanced alternative payment models. Most clinicians will end up associated with MIPS, or the merit-based incentive plan. The details of all of this aren't as important as the general trend. MIPS involves 4 elements that clinicians need to demonstrate successfully to maximize their Medicare Part B payments: These elements are to report on quality, to report on resource use, or FFS, to report and identify clinical practice improvements or CQI activities that they are engaged in their practice, and to use health IT efficiently. Even if you think that MACRA and MIPS doesn't apply to you, if you can demonstrate these 4 elements in your practice, you can succeed in a value-based payment environment. The TCPI and their networks are meant to provide clinicians with skills necessary to execute these 4 elements in practice. We know that NPs have a large and growing role in the healthcare delivery in the United States, especially in primary care. The NNCC and the AANP want to connect nurse practitioners to TCPI-funded practice transformation networks. These peer-based learning networks have the responsibility for enrolling and supporting clinicians. They provide free boots-on-the-ground technical assistance and services to help realize practice transformation. How can we as NPs help the PTNs by serving as leaders in these networks? NPs are more familiar with many aspects of the change package than physicians. NPs have experience working in collaborative, interdisciplinary, team-based environments. PTNs can provide NPs and nurse-led health centers with critical resources for practice improvement, as well as access to larger networks of clinical peers. This helps to pull NPs and smaller nurse-managed health centers out of isolation. At this time, I would like to turn over the presentation to Suzanne Bronheim. Suzanne?
Yes, thank you. So if we can have the first slide. So today I want to talk to you about an opportunity that we have at the National Center for Cultural Competence for healthcare professionals to do some related to cultural and linguistic competence. And one of the first things I want to do is to start with making sure that we're on the same page. Whenever we go and talk to people about cultural and linguistic competence, we realize that people have maybe very different ideas about what that is or what that might be. And there's also, you just saw it popped up on your screen, so many culture blank kind of things that float around in the world. And so I want to be clear what we're talking about. One of the things that's really important to us is the word competent, because in healthcare we all know we have to have important competencies if we're going to provide effective care. And that just perhaps being aware of things or sensitive to things or relevant to things, all that's great, but there's in fact a set of knowledge and skills, actual competencies that we need to do this work. Now, whenever I talk to nurses, it's like preaching to the choir, because the nursing field has been so far ahead of so much of else in healthcare for years, understanding the importance of culture, the culture of our patients, our own culture, what we now call the culture of healthcare, because that has its own ideas and values and perspectives. And when they all come together, we really are having cross-cultural encounters, and we really need to understand how does that affect care. When we wonder why patients might not follow through on suggestions that we've made, or when we find that people don't return for care, or when we make recommendations and families end up finding them strange or sometimes insulting, none of this works well if we're going to really get where we need to go and keeping people healthy and having good well-being. So culture is really, really important. And cultural competence is where we think about how are we going to address that issue of culture that comes up in every encounter we have. We also talk about linguistic competence, and when we get to talking a little bit more about the tool itself, I'll give you our actual definition of that. But if we could go to the next slide. This is the definition that we roll with. And so the cultural competence, and it's interesting, you'll see it talks about organizations. And so maybe I should step aside for a minute just to say why that's true. And we'll get to what it means for individual healthcare professionals. But we really have had a strong belief and understanding that if organizations don't address this issue of cultural competence and with what you can see here, values, principles, behaviors, attitudes, policies, structures, and practices, it's pretty hard for an individual clinician to be able to manifest cultural competence with the people they're serving, because we need all kinds of support. So this definition is about we need all these pieces in place. And then the really important piece is that enables them and the people who work in the organization to work effectively cross-culturally. So cultural competence is not, from our perspective, I'll sometimes get calls, somebody will say, so you're going to tell me how to work with Hispanic patients? Like, well, no. First of all, why would I be the person to talk to you about that? But secondly, this is not about a cookbook approach to certain groups. It's not about, I'm specialized in working with one population. It's a broader set of knowledge and skills that helps you work effectively cross-culturally. And some of that, depends on who's sitting on the other side of the table from you. So if we could go to the next slide. So, that's great. So we have an organization and we want them to have policies and structures and that sort of thing and resources. And what we mean, the kind of policies we'd hope an organization, because some of you are leading practices, are things like, is that part of the skill set you require of people? When you evaluate people in an organization, do you look at issues about how they work cross-culturally? When you're hiring people, is that a skill set you advertise for? If you have people who are speaking languages other than English or have a disability, for example, if they are deaf and might need interpretation services, do you have resources built in, or do you have some way that you can arrange for that with them? They're legally mandated if you're taking any federal dollars. But there's also at the individual level things that we really need to think about for ourselves. So here's our favorite 5, and I'll just talk about each of them a bit. And the first one is really acknowledging cultural differences. And this may seem strange, but in fact, sometimes people really want to talk about how, yeah, but we're all really basically all the same. I work a lot with kids, so people will say, all parents are the same. Everybody wants what's best for their children. And that's true, absolutely true. But culture helps us define what we think is best. So for example, one cultural answer to that might be that one of the things I think will be best for my children when they get to be, late teens, early 20s is they're living on their own, they're independent, and they're self-supporting and, going off in their life. From another cultural perspective, it might be, so it'll go well if my children get to that age. If they're not married, they're living at home and still seeking my guidance and my wisdom while they develop their lives themselves. And once they get married, then they can move on. So culture defines, what we think is important and what our values are. And when we don't acknowledge cultural differences, we really then are missing the boat. And I know it sounds pretty simplistic, but in fact, I hear it over and over again. So acknowledging cultural differences. And, sometimes we don't realize that something's going on as a cultural difference. And one of the questions I say to people always have in your head is, could culture have something to do with this? So when we have an interaction with somebody, we think, wow, what just went on? But that's a really odd response. The question is, did culture have something to do with it? And it might be our own culture, or their culture. So acknowledging that we have a culture and it might be different. Okay. So which brings us into number 2, which is understanding our own culture. Can't tell you the number of times I've gone out to talk to people about cultural competence, and somebody will come up to me, particularly white people, and they will say, well, you know, I don't really have a culture. And it's like, well, no, you really do. We all have a culture. Human beings, being human means we have cultures. We have beliefs and values and ways of doing things. What happens, though, if you're part more of a majority culture, it just feels like that's how life is and that's what's normal. And we sometimes think about, well, culture is that weird stuff other people do. But if we don't understand our own culture, then we can't understand how our reactions are affecting our interactions with other people. And it's not just our personal culture, it's our professional culture and the culture of healthcare. For example, in the culture of healthcare, we believe that evidence is what really guides what we do. That's where the wisdom comes from, is from evidence. But there are people we work with for whom the evidence is not so compelling. What's compelling to them, where the truth comes from, it might be from tradition or from elders or, you know, now from the internet, God knows. So if you need to understand your own culture, because if you can't see your own culture, then you don't understand that you're always in these cross-cultural interactions and how that might affect it. 3 is engage in self-assessment, and that's what we're going to be talking about today, one way that you can do this. You know, it's very interesting, you know, because people like to say, oh yeah, I've got this, I know it, I understand it. But when you engage in self-assessment and go into the details of what's involved, sometimes that's when we find out, like, wow, there's some area for growth for me here. I never even thought about that. So self-assessment is important. Then the next one is acquiring cultural knowledge and skills. So we do need to know something about the people that we work with. And that includes, you know, their beliefs, how they see life cycle events, their views on illness and on health. And so we need to put some work in on that. And, you know, you can do some of this reading, but, you know, I always say you can't do cultural competence alone in your office. You really need to be talking to people from the communities you serve and learn from them and share that knowledge with colleagues, because sometimes within an organization we have one person who says, that's the person, if somebody of this background comes in, she knows what to do. But that person leaves, what have you got left? So you do need to work on this. It's a competency. It's not just a feeling. So you have to put some time into it. And the last one is really viewing behavior within a cultural context. So it's what I said before. What's culture have to do with this? So culture changes over time, even our mainstream culture. You know, I always wonder what my grandparents used to like to watch this show called Lawrence Welk. It was this music show, and it was advertised. The advertising was by this product Geritol, which was supposed to pep up old people. I think it turned out there was a lot of alcohol in it. I'm not sure, but I always think, what would they, if they came back now and saw a Viagra ad on television? Wow, what would they think? Because the culture has changed, and even for ourselves, what what a behavior means depends on what the cultural context is. So if years ago I saw somebody walking down the street and they were by themselves and they were talking in an animated way and gesturing, I might have thought one thing. Now I might think another. And I have to say it took me a while to catch on to that Bluetooth stuff, because for a while I kept going like, what's going on with that person? So culture, it gives us the context to understand behavior. And when we're working with patients and their families and their communities, if we don't understand that context, we really can't do our work very effectively. So if we could go to the next slide. So one of the things we talk about is this little continuum. Because sometimes I will get phone calls for somebody who says to me, can you come out and certify us as culturally competent? And I wish we could. Our funding woes would be over. But really, it's this ongoing process. And, Cross-Bazra and Dennis and Isaacs really laid out this really interesting continuum. We start with cultural destructiveness, and those are practices that really are designed to destroy culture. I mean, the boarding schools for our Native American kids, they set out to destroy their culture. In fact, the current definition of genocide, or on the worldwide basis, is not just killing people, but trying to destroy their culture. But then there's this cultural blindness, which is kind of in the middle. Remember we said we have to acknowledge differences, but we get people who will say, yeah, we do it the good old American way. We treat everybody the same. It's fair. But we know that if we treat everyone the same, it's not going to work out so well because not everybody is the same. So we hope cultural competence, we're moving up there. And the idea is, it's not about even the self-assessment process. It's not, did I get a good or bad grade? But where am I and how can I move a little further along? And also understanding this can be cyclical. So for example, the populations that you're working in within your communities today, you may really, get some really great competence going. But now a whole new group moves in. We have people move in and out of communities. You may have to begin again, but hopefully you're not starting from the bottom. So if we can go to the next slide. So we set out a bunch of years ago. Actually, this all started when we had funding from the Bureau of Primary Health Care. They wanted some kind of assessment tool for healthcare practitioners that they could look at themselves and get a reading of where they were and what they needed to do. So we developed, at that time it was the Cultural Competence Health Practitioner Assessment, because the whole issue of linguistic competence was still evolving. And we had a group of experts think about the kinds of questions and things that would indicate that people were doing pretty well on this. We then did a lot of work with health practitioners from community health centers giving us feedback on that. We tested this out in those kinds of settings. And we had a whole set of questions. And we had this online tool for many years that had lots more questions than this one. And what happened was after you answered the questions, you got some feedback about a level you might be at for different areas and some suggested resources. Well, tens of thousands of people used that tool. So at some point we said, okay, everybody's wanting to know, can we get anything that's a little more psychometrically based? So we were able to, in a partnership with Case Western Reserve Family Medicine Department, we actually looked at psychometric properties. We took a sample of about 2,500, and we were able to get a core set of questions that were really pretty good in terms of psychometrics. They really delineated who had more or less skills. They really, made sense in terms of some of the statistics that they did. And we said, you know what, so it's time to update what we've done online. So that's what you're seeing now on your screen, the Cultural and Linguistic Competence Health Practitioner Assessment. And so this is the new version. So if we could go to the next slide. As I mentioned, we got this input. And I have to say, nurses are our biggest customers because, of course, nurses have always been out front with this and understood it. 1 year, when we had 10,000 people came and accessed it, 70% of them were nurses, which is pretty impressive. So the next slide. The kinds of people who've taken over time, you can see it's this whole range, multiple types of nurses, social workers, psychologists, MDs, DOs. So it's been a tool that's been used and accessed and being useful to kind of a pretty broad array of healthcare practitioners. See the next slide. So we took the psychometrically sound, really, we were very excited about all when we had those questions. But then we realized we wanted to add some new questions because the original tool had not dealt with linguistic competence. And let me tell you how we define that, which is really the capacity of an organization and its personnel to communicate effectively and convey information in a manner that is easily understood by diverse groups. And it includes people of limited English proficiency, because we always think about that, those who have low literacy skills or are not literate, individuals with disability, those who are deaf and hard of hearing. And so it addresses also health and mental health literacy needs of populations. So it's really about, we talk about language access when we talk about people who have limited English proficiency, so they need interpretation, translation. But we also, in our model, really think about all kinds of communication. I often, when I'm talking to audiences who aren't healthcare professionals, I say we all probably might need an interpreter when we go to see a healthcare professional because we're talking two different languages. But so we have to attend to those kind of things, health literacy and actual literacy, as well as people with disabilities. We also realized that we hadn't really asked much about health disparities and people's awareness of that. And so the new tool also includes a section on health and healthcare disparities, and it looks at the capacity to recognize and address health and healthcare disparities that impact diverse patient populations, both within practice settings and the community at large. So this new tool up has two sections about that. And the next slide. So one thing we want people to understand is we have some assumptions when we go into the self-assessment stuff, is that it's a developmental process. So it's not about, oh, you get an A or an F, but that you're on a journey here, and that with appropriate support, individuals can always enhance their knowledge and skills over time. It's not about being a good or bad person or a good or bad cultural competence person. It's really about this process, and that's what we hope that this tool will help support that process. Next slide. So when you take this, and I'll show you what some of this looks like, you go online, you'll log in, you put your name and your email address, and that's how you log in. And what's nice is you can go back. If you can't finish it all in one sitting, you can always go back. It provides feedback on your performance on those three factors, that came out of our study of our psychometrically sound pieces. Those three factors are knowledge of culturally and linguistically diverse populations, adapting practice, and promoting the health of culturally and linguistically diverse communities. So that was based on our norming sample. The next slide. So that's, now you can actually see them if you're a more visual person. Those are the three factors. So you'll get a score for each of those factors, and you'll get some feedback about where you stand. Okay, the next slide. And then we give you feedback on our new two areas, this linguistic competence area and health and healthcare disparities. We can have the next slide. So you actually get a report. It will pop up. You can print it out. You can save it as a PDF. And you'll get your scores on the three factors and how you compared to the norming sample, and then your levels in relation to those two additional areas. The next slide. So this is what sort of the first part of your report would look like. So it will give you your score. It'll tell you the mean score from our validated sample for those three on the top. So you kind of know above the mean, below the mean, somewhere near it. And then it explains to you what kinds of things were in each factor. So factor 1 reflects knowledge relating to delivering care. Factor 2 is really how do you apply the knowledge and skills? What do you do differently when you're trying to work cross-culturally? And then the last one is about attitudes, intentions, and knowledge about really addressing health issues that can affect communities. So when we've looked at culturally competent practices, for example. They do a great job with their patients, but they're also often deeply engaged in their communities to try and improve community health. Then our two new guys, the linguistic competence, so you'll get a score, but we don't have any norms for that, so you'll just get sort of high, medium, or low. And it explains to you, again, the definition and says, it asks you about things like, do you know about legal mandates for language access? Do you know about evidence-based practices in health literacy? Advocacy to address communication preferences of people. And then on the healthcare disparities piece, again, you get a score. And then, do you know about health disparities and how they impact health? Do you know about the factors that contribute to them? Do you know things that could be done to maybe make a difference and about engaging in your community? So this is, you'll get this piece of the thing back, and you'll know kind of where you stand. And then the next slide. But then the cool part, I think anyway, is that part of your report is you get a set of professional development and educational resources that relate to the 3 factors and linguistic competence healthcare disparities that are customized based on your scores and levels on this. So you not only get well, here's kind of where you are on the journey, but we talked about, and here's some things you could use to learn to increase your knowledge and your skills to move you along even further. If I can have the next slide. So you will get screenshot. It's a little blurry, but you'll get a report that gives you resources based on each of the sections, and some of them are web-based. You'll get web-based. You may get books. You may get journal articles to read, and they're tied to the topic and also to sort of where you are in the continuum. So if you're just starting out, resources might be more things that get you beginning into the topic. If you've really scored very high, they might be things that provide you with some really detailed information or really ways to enhance your practice. Excuse me. So can we have the next slide? So we often say that cultural competence and linguistic competence are a journey and not a destination. And what we hope is that this is one tool that you'll be able to use to help you along that journey, because sometimes it's good to know where you are on the road, just sort of your scores and how you're doing, as well as some roadmaps to get where you want to go. And so that's why we have designed this. And it's really designed as an online learning tool, self-assessment. Excuse me, I'm sorry. It's not like a measure. And it's not to give you a grade. It's really to help you figure out, what can I do next so I can learn more? So can you have the next slide? So this is just to say to you, this is where we are at the National Center for Cultural Competence. These PowerPoint slides, and I think you'll have access to them, but just to remind people that they are copyrighted. If you want to use them someplace else, please get back to us for permission, which is what happened for today's presentation, so we could share them. And now I think I'll turn it back over to you guys.
Thank you so much, Suzanne. This is really great information. I just wanted to move us along here to the Q&A portion. And this would be the time, if you do have questions, to go ahead and put your questions in through the chat box, and we can field them to Suzanne for you. One thing that I just wanted to, 2 things I wanted to mention, excuse me, as people are doing that and thinking about their questions. One is I wanted to let people know that so this is Cheryl Fatibani, I'm a family nurse practitioner. I went in and did the assessment. I just wanted to mention a couple things about the process of doing the assessment. It was, one, much easier than I thought it would be, and shorter than I thought it would be. I thought it would take a really long time to get through the whole thing. It does take a little bit of time, but it really was not as long as I thought. And the answers that I got back in terms of my own personal cultural competence were not what I expected. So there were some surprises. I scored lower in areas that I thought I should have scored much higher. So it was a bit of an aha moment for me to really go back and kind of rethink what I think I know about my cultural competence. So I would say just from the self-assessment standpoint, if you do go in and do this, and I would really highly encourage people to do it, just be really painfully honest, because you really do want to get some accurate information back about where you might improve. So I wanted to say that one piece of it. And then the other piece is for you, Suzanne, to maybe talk for a few minutes about how this has been used in practice. I know when we spoke, you had mentioned, I think it was a school of nursing or another location that had been using this with their students. If you can just talk to some of the practical uses for this kind of out in the world that you've seen since it's been available.
Sure. So yes, I mean we actually have multiple schools of nursing, other health professional training organizations that will actually make an assignment to their students to go and take this, and now they can easily print out their report to bring back, and it's not to measure where the students are, but as a way to now begin a conversation and a learning process, and maybe for a group of people to say, boy, we all got the same resources, let's look at them and talk about them together. Actually, a large, I can't name it, but a large managed care organization offered this to a set of their practices to do this, and for individuals to get feedback, and then said to them, if you get back to us and tell us, which of the resources you pursued and learned from, they gave them some sort of, and I don't know, certification, but some recognition for that. So it was a way, they used it as a way to really encourage that in the practices that, were contracted with them. There is some organization that has actually said when people want to re-up for their, I don't know if it's their membership or certification, they had to show that they had gone and taken this. This was a way they could document that they had done some sort of training for culture.
That's great. Just some things that come to mind right off the bat with this in terms of professional development for all of you on the
So I'm
line.
done.
Pardon? Yes, so just something I wanted to mention for all of you, just in terms of the professional development piece of this, that cultural competency is something I think that we may not all get as much as we need to in our trainings. This would be something where I could see you not only as an individual going in, and we've reposted the website address there for you to see it. So you can go in, you can do the individual assessment, and then I would strongly encourage you to, if you were in a school of nursing or on a faculty, and it looks like we have some people that are, to take this back and look at that together to see, how you can do some assessments. And I just wanted, Suzanne, any thoughts on that and utilization? We did have a question coming in from Joe. Just saying that this looks like it'd be a great assessment to use with faculty and students, and is it available for that type of sharing?
No, it's not available as a measure for you to use that way. It's really it's an online self-assessment learning process. Now, if a group wants to say, let's all do this and then we'll talk about our results, that would be great if they feel comfortable sharing it, but it's not available as a measure. And I know we get that question probably 3 times a week, but first of all, we're not sure the psychometrics are there yet, and but that's why it's really meant as an online learning experience.
Right, so that if students did want to go in and do that and then have general discussion on that from taking the self-assessment course, they could do that. Is that correct?
Absolutely.
Okay.
Yeah.
All right. And I'm hoping that answers your question, Joe. Maybe just, I don't see anything coming into the queue right now for other questions. I know we had talked earlier about some other things to bring up for this group that you thought might be helpful for them.
Right, right. So sometimes people say, well, I've taken it once, now I've done some learning, I've lived life a little more, can I go take it again? You can. So there's two things. When you go back in, it'll pop up what you've done already, but you can go through and basically changing your answers, and it will produce a new report for you. Or you could go in with a different name and email address if you have one. I mean, sometimes we have more than one, and take it again and get it that way. But you can always go back in to your report. So first of all, even if you go like, what did I do with the report, you can go back into your session. And you can also go back and say, okay, now I'm going to take it again. I'm going to give different, maybe I give different answers this time. So that's something you can do. The other thing is that, when we talk about what is cultural competence, we ask about your knowledge about different populations. People say, well, I can't know everything about every kind of person that walks in the door. And that's absolutely true. I mean, you do have some obligation to learn. And of course, we can always learn from the person who's sitting across from us, if we ask some questions about it. And, some of those kind of questions and how we do that are in the tool itself, and concretely what are things that I do. But we can have a set of skills that, just even understanding culture and thinking about it and exploring it with patients and knowing, that it has an impact, just that alone is what's key. Yes, no, you'll never know everything about every culture that walks through the door. But if you have a set of skills for how do I think about this and how do I find out from this person I'm serving or from the community, that will take you a very long way.
Thank you. Just a couple more things. We do have another question that just came in from Sarah, and the question is, does this tool draw on the concepts of cultural humility or structural competence?
Okay, so that's what was that first thing. Let's get all on the same page. Now, cultural humility, I mean, they're all related, but it's a different concept. It actually came from physicians mostly, and it's based on this idea that, well, I can't know everything, so I have to understand from other people. So no, it really comes from the construct I shared with you of cultural competence, our framework. Our website is listed if you want to read more about our framework. It's all there, but that's what it comes from.
I have a question for the group. Since this is a tool and we have all of you on the line and you have the ability to communicate with us both via your chat box, and we can also unmute you if you had kind of a more, sometimes you can't put a question into a chat box, maybe it's not exactly right. So two things. One is I'd like to hear from the group through the chat box of where you think this type of a tool might be useful in your practice. So if you're a student, maybe if you're in some sort of a clinical practice where you feel like the cultural competency barometer is pretty low, and maybe introduce this, or maybe in your own professional development. So if people could use the chat box function, maybe give us some thoughts of where you see using this tool in your day-to-day. Or you can raise your hand and we can unmute your line and you can talk directly to the group. I'll give people a minute to do that.
So while they're thinking about that a little bit, your experience with the tool of like, wow, I didn't do as well as I thought. What's interesting is we haven't been able to do retest reliability, which is why we don't think it's ready to be a measure. And one thing we've seen is some of our other tools is that when people first kind of rate themselves on stuff, they think, oh yeah, I'm doing great. When they actually spend some time learning about it or the specifics of it, they sometimes rate themselves a little lower the second time because they think like, oh, I thought I was all over this, but there's stuff that I didn't even think about. So, I mean, that's part of that learning process, but that's a piece that we're still trying to figure out in terms of how does this work as a measure, because, you know, people want to use it to show that they've done some intervention and people's cultural competence got better, and until we really know what actually happens when people take it another time, you know, we could be leading everyone down the wrong path.
Thanks, Suzanne. We had a great comment come in from Dawn talking about faculty development and using this with individual reflection. And Dawn, we would love to unmute your line, and maybe you can flesh that out a little bit more for us and tell us how you're thinking this might be helpful for you in practice. Dawn doesn't have a microphone. Okay. Then can you chat in a little bit for us, maybe what you wrote? There you go. Or there's another question. So maybe we have another question that came in, or just a utilization. But Dawn, if you could just give us maybe a little bit more background about your, if you're on faculty, and what type of a facility it is, and how you might use that in reflection, that would be great. Okay. What's that? She can elaborate on the response. Jean, can we unmute you so you can talk about your response to this? You have a nice response here. Jean, are you on the line? Okay, Jean.
Hi.
Hi, Jean.
Can you hear me?
Yes, we can.
Hi. Okay. Yeah, I'm a family nurse practitioner, and I work at a large public university in the Southwest. And we, in our campus health centers, we have a large number of international students. And I am also a Doctor of Nursing Practice DNP student. And I just completed a project on improving culturally competent care for international students, where we found a need that we had a lack of. Well, for one thing, the Chinese students represented about a third of the 10,000 international students that we have enrolled. And there was very variable English proficiency, and of course, therefore, variable health literacy. And so we incorporated an online resource for translated print materials, because we didn't have translated print materials for Chinese embedded into our electronic health record. And so I conducted a project where we incorporated that into the setting and gathered feedback from students and providers about the usefulness of that. And so it was interesting results, because the students were overwhelmingly satisfied with having that extra attention and additional print materials to supplement the health information they were receiving at the visit. The providers, there were some limitations to the use for the providers in terms of time needed to download and print the materials and so forth for the students, but yet the providers felt that it was a very useful tool. I could see this tool, this assessment tool, to be very, very helpful to have the providers complete, so that we could get a sense of really more information about where we are with our culturally competent practices and perspectives. So I see this as a very useful tool.
Right. That's always, from our end, that's nice to hear. I mean, I was also thinking, you were talking about this continuous quality improvement piece. If a practice or a group decided that we'll all do this, and then think about the items that, you know, the specific practices or actions that, gee, I don't know how good we're doing with that. It might spur some conversation about doing some kind of a quality improvement effort related to something very particular. So it's because cultural competence feels so global, but this actually, you'll see, it's going to ask you about specific stuff you do, and that might give you some starting points too.
Yes, I agree. I haven't completed the assessment myself, but I see where it could help to identify specific areas that could be then addressed in a clinical practice setting.
Great.
And this is Cheryl. I just think one of the great things about this is, for those of you on the line that know about PDSA cycles, the Plan, Do, Study, Act, this is a perfect example of that, where if you really want to take a deeper dive, even into the culture of the setting that you're working in, and this would be a nice one where maybe there might be some issues or problems, but not everyone necessarily agrees with you on that, where you do this, you have people take the assessment and maybe bring people around at a staff meeting, or again for professional development, with staff that maybe could use some help in this area, and it's a really nice way to introduce that concept of how do we work. Like I said, I did it and I was frankly surprised. I didn't do better than I did. So I wouldn't be at all surprised for many of us if we went in and took this, that we may not come out as wonderful as we think we are. So it was holding up that mirror is always a little bit tough. I wanted to move it on to Joe. We're going to unmute your line, Joe, and have you talk a little bit about your incorporation of cultural competencies into your curriculum.
Yes, thank you.
Thanks for joining us.
I was very interested to hear your presentation, and it was excellent information. We have had questions from some of our community partners about how and where we incorporate cultural awareness, cultural competence into the curriculum. And so as faculty, we've been discussing that. And I do several things throughout my coursework, but I love this assessment idea, and I'm thinking about asking faculty to take the assessment and then come together and talk about what we're doing in light of this type of a assessment and using the resources to improve that piece.
Great. So I'm going to give you a plug for another product of ours on
Okay.
the National Center for Cultural Competence website, and it's under distance learning. We have curriculum enhancement modules where
Great.
it's got sort of content, activities, things you can pull in. Some of the references are older than I'd like because we're no longer funded for it, but the basic stuff is really pretty cool, the people who pulled that together. So that could be useful too. And this is as part of it. And there's one of the modules I think is on self-assessment, or this could be part of it, but you might get ideas from that too.
Great. Thank you very much.
Mm-hmm.
Thank you. So Dawn had a comment about this as well, and she doesn't have a microphone, so I'm going to read it off for her. When we talk together, it can be hard to be honest, university faculty, but with self-reflection, we might be able to bring ideas to improve our curriculum, both for serving our students and instructing them better in this area, and long-term, improve patient care in our area. We are in Southern California. It's a very diverse population and community, and boy, amen to that. I think that we're looking at such incredible diversity throughout. And I think these are times too when we really need to kind of circle back with our faculty, our students, and our patients, and really call that out and kind of see where we stand. Oh, sorry, go ahead.
And just one thing, and diversity, I mean, and culture is not just race and ethnicity. We have diversities around rural and urban. I mean, what's happening in our rural areas right now is pretty terrifying. We've got cultural pieces that relate to socioeconomic status. There's a lot of other issues, and how people may be culturally different than us who we're serving. So absolutely.
Yeah, so true. We do have a question coming in from Angel asking, where can we find the online curriculum enhancement modules that you had just mentioned?
Okay, so can we go to my last slide?
Okay.
For a second, because it gives the website. I'm always afraid if I say it, I'll say it wrong. Right. So nccc.georgetown.edu, or you can just Google National Center for Cultural Competence. We're about to launch a new website, but wherever you look for it under distance learning. There may be a button for it. If not, it'll be under products and publications, distance learning, and its curriculum enhancement modules, and they're there.
Great. Angel says thank you. Can we move to the next? Let's move to the next slide. So I just wanted to thank Suzanne for her work and for graciously deciding to be with us today and to share this information. It's really excellent information, and I think it's good for all of us to sometimes rethink where we are professionally and even personally in the work that we do day to day. I did want to just put this slide up here. So we had talked at the top of the hour about the Transforming Clinical Practice Initiative and our Nurse Practitioner Support and Alignment Network, which is where both Tiffany and I work. So if you as an individual provider or a practice, or if you're interested in getting more information and finding out about the work that we are doing to help support nurse practitioners as we move through payment reform, our contact information is there, as well as the website at the very bottom, which is our collaboration with the AANP, which will give you, if you have no idea what we're talking about with practice transformation, and it is a new concept, even though the word is sort of out there on the street, it's really not as widespread as I would hope. I would hope that all of you, if you're providers working in any kind of a clinical practice, go to that web address and read a little bit more about the work that's going on right now with the practice transformation networks, and know that we are here at the NNCC as a support for everyone. We do work with nurses and nurse practitioners, but we really work with everyone. So if we have any pharmacists, social workers, other people on the line, if you have any questions or if you'd like additional information, please go to that website. Suzanne, any last things before we're almost at the top of the hour?
No, just thank you so much for inviting me.
Well, thank you for participating and sharing your great work with us. I don't see any other questions coming in right now. Just a reminder that you can get the handouts. After today, you will be getting a survey after today's presentation. If you could give us your feedback, that would be great. We'd really appreciate that. This is part of a series of Lunch and Learns we do monthly at the Nurse Practitioner Support and Alignment Network. We'll also be interested in your feedback on topics. If you have anything of particular interest, you can share that with us as well. Our next Lunch and Learn will be next month, and it's part 2 of a series from ARC on medication management and also the warm handoff, both kind of clinically related, and we hope that you will join us. And thank you, everybody, and have a great day.